Hello and welcome to another episode of Social Workers Rise. It is your host, Catherine here. If you don't know who I am an LCSW based out of Southern California. I am a mental health therapist. I have extensive background in medical social work. Additionally, I do career coaching and speaking on mental health topics such as burnout and resilience. So I am really excited that you are here today because we are going to talk with our guest, LaTasha Toney. And this episode, we're going to be talking about psychiatric social work, what it is, what does this role entail, how to get started if you don't have any experience in it, and a lot more. She is going to be sharing her personal experience as a social worker. So she is a social working therapist. She enjoys hearing people's stories and teaching them skills to reframe the narrative of their life. LaTasha Toney is also a fellow podcaster, and we talk about her podcast a little bit at the end. So make sure to stay tuned for that to hear about her podcast, Mindful Nuggets. And she is also a grief workshop facilitator. Her podcast, Mindful Nuggets, explores the intersection of Christian faith, Black womanhood, and mental health. So you are in for a treat today. Here's a couple of announcements, right? If you are in need of a clinical supervisor, definitely go to risedirectory.com to check that out. If you are a clinical supervisor who is open to providing supervision in your state, then definitely go and claim your free profile at risedirectory.com. Lastly, if you are a clinical social worker and you're interested in positions such as psychiatric social work, community mental health, CPS, APS, medical social work, then definitely check out the courses that I have created for you. There are a couple different ones that are going to be helpful. There's actually three of them, right? So one is the most popular one, the Clinical Essentials for the Future Therapist. This is going to give you the tools to give you the confidence to show up for your clients in a way that is effective and that you're able to communicate what it is that you do, the value that you bring to your organization. And this is going to help you in so many different ways. So the link is there in the show notes. Additionally, if you are a medical social worker and you struggle with having those end of life conversations and you want to learn more about this and how to keep the rapport that you've built, then check out the Pulse Basics for Medical Social Workers. And lastly, if you are just in the field for a new job and you are wanting to learn how to negotiate or even how to negotiate your raise for your current position, if you are wanting to learn about how to be well as a social worker for long term or about the clinical supervision process, then the course, the Success in Clinical Social Work, then this is the place for you. All of these are self-paced. They are pre-recorded, so you can do them at any time. You can start today. Yes, today. So definitely go on there. If you are just wanting some free tools and resources, join the email resource list, the Friday resources, where I send out specific tools for clinical social workers to help you throughout your career. So with all of that said and out of the way, let's hop into this conversation with LaTasha. Hello and welcome to the Social Workers Rise podcast. We are here with LaTasha Toney. Welcome to the podcast, LaTasha.
Thank you, Catherine Smith. It is such an honor to sit and speak with you and your audience.
Yes, I'm so excited to have you today. Can you tell us a little bit about who you are and what you do?
All right, so my name is LaTasha Toney. I am from Birmingham, Alabama. I am a licensed independent clinical social worker. Currently, I work in outpatient mental health therapist, but for the past about 8 years, I've worked in inpatient psychiatry and more closely with mental health. So I am just personally passionate and interested about the intersection of Christian faith, womanhood, and mental health. I just think those things are so important to look at and assess. So I'm just on this journey to help people who are involved in those three things to get support.
That's great. Thank you so much. I'm wondering for your work, what does a day in the life look like for you?
All right, so currently I work as an outpatient therapist. So do you want to hear about that or about the inpatient psych part?
Can we do a little bit of both?
Yes, we can talk about both. All right, so currently I work as an outpatient mental health therapist. So this job, I might have some days where I'm doing intake assessments. So people come in, I'm just trying to get a clear understanding of what brought them in for therapy, getting a good history of that person, and identifying some goals. If I just have a client who I'm doing a therapy session with, I always work from the treatment plan. So I identify what their goals are. I look at what we discussed during the last session, what things we might have talked about that they could do for homework assignments. So we might review the homework assignments. And I just see what are some things that might be going on with this person currently. And I try to tie that back to our treatment goals. So that's what I do as far as an outpatient therapist. As far as the inpatient psychiatry works, I worked with adolescents up until adults that have severe mental illness, even with some adults that were geriatric. So each unit has something different that it requires. So just general inpatient psychiatry, we have people who come in and we're required to assess this person within 24 hours. But because they're coming into the hospital and just how the medical model works, it's really good to try to assess that person as soon as possible. So we try to get our assessments done within 24 hours of that person coming in. So I will talk to this person directly, get information from them. If they allow me to do so, I might get collateral information from this person's family or other people in their life who would just know things about this person that maybe the patient is just not comfortable with talking about, or they just might not remember. If they're like a person who has dementia or Alzheimer's, they're not going to be a really good historian if they're an adolescent too. They just might not know something. So I just might, get information from a collateral resource. And I'm also part of daily rounds with the doctor. So the doctor comes in. If it's a very new patient, I might share what I have learned from my assessment process. I might talk about how what the family's concerns are, where this patient could return after their discharge from the hospital. So I just really help the team to understand the whole person and environment fit of this client, and how those different things will impact their situation. Do some discharge planning. So I might refer out to an outpatient therapy provider or a psychiatric nurse practitioner or psychiatrist for follow up, or other things that they might need that will help them once they're discharged to be successful.
That's awesome. So you're really seeing them on the spectrum of from the inpatient psych hospital all the way to outpatient therapy, like in the community. Is that right?
Yes, but I do not work with people in the hospital in my outpatient therapy. That's a conflict of interest to me. So it's totally separate. Even like the population I serve, they're not in the community that I work at the hospital. If that makes any sense. But yes,
Yes.
I'm able to
Yes.
see two different perspectives of, the inpatient and the outpatient, all of that. So yes.
Right. Yeah. That's amazing. How has that been able to help you? Because currently you're outpatient, right? You're not working in a psych
Mm-hmm.
hospital. Okay. So, how
Right.
has your experience in the psych hospital helped you or contributed now to the work that you do outpatient?
Well, working in inpatient psychiatry, I would get a little frustrated, for a lack of better terms, because people would come into the hospital, they would get medication, it would stabilize their symptoms, they would be discharged. I would get frustrated because sometimes we would have patients who would come in and I could see they had a clear need for therapy. And so once they were discharged, they were not able to go to therapy for, it could have been due to financial reasons, insurance, transportation, just different things like that. But I could see how if they were able to go to therapy, it could help prevent these readmissions to the hospital. So I wanted to kind of be a person that worked on the outpatient therapy end to kind of help people to stabilize their symptoms so they would not have to go back in. So I've just been able to see how on an outpatient therapy point, I'm able to, have a really good assessment of people, their situation, and provide them with some tools that help to prevent them from getting into this crisis situation.
Right. That makes sense. So do you consider the work that you do to be psychiatric social work, or is that just solely in the psychiatric hospital?
Um, it really depends on the client, but more so psychiatric is more in the hospital. Yes.
Okay, that makes sense. Because I was always
Hmm.
confused because I've never personally worked in a psychiatric hospital. And then I wonder, people who work, because there's a whole spectrum, right? Like you said, the people in the hospital
Hmm.
now need therapy. I wasn't sure kind of what the differentiation was. So what's your role right now as an outpatient therapist?
So I just solely provide therapy, but I can pretty much work with anybody who has a variety of issues. From like I have my youngest client right now is 6 years old. My oldest client is probably like 64. So I work with people across the lifespan who have a variety of issues. So I'm really a researcher because somebody might come in and the issue might seem like, oh, I've done this before, but each person is different. So just really getting a clear understanding of who they are and how they're impacted by different symptoms, not symptoms but systems, and just helping them to understand that and using different modalities to um, provide therapy to them.
Great, yeah. I'm wondering, for your work as a psychiatric therapist, what would you say was the most challenging part of the work? And you kind of touched on it a little bit, but I just wanted to be clear on, what you felt was the hardest part.
So the hardest part for me being a new psychiatric social worker was knowing my role as the social worker. In a hospital, they have this whole medical model. So the doctors are using this medical model to provide treatment to the patients. And that's not my role as the social worker. Just kind of understand, what my role is. Being able to advocate for my clients, communicating to the doctors about what's going on with this situation because they only see, one part of this class, and just really being a resource for them. And a lot of this just involves being confident in my skill set as a social worker because it can be intimidating to work around these doctors who have all this experience. Sometimes we feel like doctors are more educated and more intelligent than us as social workers. And I actually had a good colleague of mine to remind me that yes, the doctors are an expert in their field, but we're also an expert in our field as social workers. So just being really clear on that. So because we talk about imposter syndrome sometimes, and a lot of that is just not being really confident in yourself and your abilities as a clinician. We're always growing, we're always developing. So that was like a long answer to your question, but I hope that answers.
Yes, no, beautiful answer. And I love it because you bring up a really great, well, it's not a great pain, a common pain point for a lot of us as social workers, because especially as new graduates, and it's May now, so we have a lot of new graduates entering the field, and a lot of people who are encountering professionals who have been doing this for 20 plus years, especially doctors that are very confident, they're very sure, they may not respond well to people challenging them. I like to say giving
Mhm.
another point of view. But what would you say that we bring to the table as social workers? One of the things that I heard you mention is that we're able to bring a systems perspective and being able to essentially fill in the gaps for the medical team about this patient as a whole person, or it's also called whole person care, right? So, not just
Mhm.
the physical care, not just like they have depression, but being able to look at the social supports, their hobbies, are they able to work anymore? What is their purpose now? right? What kind of family do they have? What kind of living environment are they in? Do they have transportation problems? Uh, so that's, the systems perspective. I'm wondering, what other strengths do you see as social workers that we bring to the table, specifically within like a psychiatric or medical setting?
Yeah, so I say one thing is educating the team about what resources are available for this person in the community. Like if they're having financial issues, how this impacts them from being able to get medication, identifying ways they're able to obtain medication, just really educating about resources, educating about the whole family environment, the community. Just really, like I said, we're a researcher and we're educating the team. I don't think we realize how much we know as social workers. I would say that's the main thing. Because one
Yes,
thing that I worked at a university hospital, so it's a teaching school, so we have residents and we have medical students. So a lot of times they're only seeing this one part as they're going through their programs. So by them working with a social worker, they're able to identify at least there are these other things that go into caring for a patient. So it just really helps them to understand how there's different avenues to provide treatment to the patient that they're working with.
for sure. And I love that, at least in the settings that I've been in, is that the medical field is starting to recognize the value that we bring to the client to reducing the readmission rates. Because if we have a person like you said, who is admitted, and if we can just hook them up with some therapy, then we can
Mm-hmm.
prevent thousands of dollars of costs for the healthcare system. And I know that as social workers, that's not our main intention. However, that's going to be a really key part in communicating our role to other industries, right? When we're getting
Mm-hmm.
hired, when we're pitching ourselves, when we're talking to CEOs, when we're talking to HR, when we're talking to finance people, is being able to make that connection between what we're able to do, the resources we provide, and the value that we bring to organizations. I would love
Right.
to just have that communicated more in schools of social work, because it would help us to be able to share confidently what we bring to our table and speak the language of the person that we're talking to,
Right.
especially if it's
Mm-hmm.
within other industries. So
Right.
I love that. Thank
Wait.
you.
So you used the word recidivism, and that refers more to crime. But when we talk about mental health, psychiatry, or substance abuse, it's relapse prevention. That's the thing. So when people are returning to the hospital, we're actually trying to prevent that. That's relapse prevention. So I just wanted to clarify that.
Thank you. Yeah, because the recidivism felt like the wrong word, but thank you for
And I'm
clarifying.
like, yeah, that's the right word. It's actually relapse prevention. So that just came to me as you were talking. So it's all
Thank you.
good
Thank you
because they
for
really go
connected.
together. Yeah, they go together. So
Yeah, thank you. So, what would you say is the most rewarding part of this work or working in a psychiatric hospital?
being a resource for the patients who I am assisting, because a lot of people come in, they don't have family members sometimes, they don't have friends, they just really don't have nothing. I've seen some people who've had some really hopeless situations. So to be able to connect them with their basic needs has been really rewarding for me. And being able to educate families about different things. Because some people just don't know. They think that this person is making up this condition. So just helping to educate them and for those light bulbs to go off for them and to just give them a sense of hope that their loved one can make it through these situations.
Yes, for sure. Yeah, educating the family and just supporting the family, because if we don't have that support system for the patient or the client, it's really, really challenging to help that client long term. I don't know about
Mm-hmm.
you, LaTasha, but I feel like a lot of the people that I've seen that need the most help are the ones with the least social supports.
Yes, that is so true. So
And it
true.
seems it seems like the people that come through and they do have a lot of social support, maybe they have, even if it's really a really good set of friends, right? They just have a really strong community of friends. Even that can go a really long way in just being able
Mm-hmm.
to ensure that they have the support that they need to stay safe at home, to talk to people if they need to talk to them, just to get that
Right.
support.
Right. We call those
So I don't know
protective
if you,
factors. Sorry. I'm sorry. I just talked
yeah, I
over
was going to
you.
say, I don't know if you've seen that again. No, you're good.
Yes, but we call those protective factors. So, having health insurance, having employment, being a part of a church, having friends, having family, all those things can support a person in being more successful in preventing relapse in most cases. So that's a really good point.
Yeah, yeah. And they really do make a difference. And that's another beautiful part of the strengths that we bring to the team is being able to tap into those protective factors. So I'm
Hmm.
wondering if for listeners right now, if we are interested in getting into psychiatric social work, what kind of tips do you have for us?
I would say if you have not, let's say you're still in your BSW, MSW program, I would inquire about opportunities to do a field placement related to psychiatry because you have community psychiatry. We have like these community mental health centers. That would be a great way to get some mental health experiences. A lot of schools now have programs through the mental health center where the children can receive different services at school. So, inquiring about programs like that and just spend some time researching, maybe contacting a social worker in your area. I know we sometimes have these assignments in school. We don't really take those things seriously. So maybe you have an assignment in school and it's asking you to contact a social worker, actually find someone at a hospital who you're interested in talking to, call them, ask them questions, learning about some basic disorders, learning about depression, learning about anxiety. Um, making sure you have really good assessment skills. Assessments are that's such an important part of what we do. Looking at some different group therapies. As you're in your classes in school, taking those practice classes seriously. Connecting with faculty in your program who might have an interest in psychiatry or mental health. I think those things can kind of help you to set yourself up to be successful. Those are some things. And just
Awesome.
knowing about different programs in your community that address the needs of those who have psychiatric conditions, that can be important. So,
For sure. Yeah, awesome.
mhm.
And I understand that you have a podcast too. Can you tell us about that?
Oh yeah, so I do have a podcast. It is called Mindful Nuggets. As I mentioned earlier, I'm really passionate about the intersection of Christian faith, mental health, and womanhood. Just being that I've kind of experienced things in those areas myself. Just want to support others who might be kind of going through the same thing. So I just talk about random topics that relate to mental health, womanhood, and faith. I invite people on who might have had similar life experiences and they just share their stories. And the goal is just to encourage and inspire those who are listening to take care of their mental health.
I love
Really,
that.
their
And
mental
that,
wellness because we all have mental health, but we don't all have mental wellness. So,
yes, yes. And that's a great
mhm.
difference. And a lot of times people will say, I'll say, oh, I'm a mental wellness expert. And they say, oh, the girl about mental illness is here. And I was like, wellness.
Right, it's
Because
different
there is a
because that's
difference.
one thing about those who work in inpatient psych. I mean, who are being seen in inpatient psychiatry. Yes, they have a diagnosed mental illness, but our goal for them is for them to have mental wellness once they leave. Because you can be a person who is diagnosed with schizophrenia and still have mental wellness by taking medication. Going to see a therapist, having a good support group, all those things help the person to have good mental wellness. You can be a person who does not have a mental health diagnosis and not have mental wellness. So the goal is always mental wellness, not mental health. we all have mental health, but we don't all have mental wellness.
Yeah, yeah. And a lot of that I found over the years that I wish we touched on more in school for social work is integrating that spirituality in there, which this is a whole separate podcast episode, but I just wanted to bring light
Mm-hmm.
to that. That I was, once I started tapping into my own spirituality, I mean, this was after grad school and I was in my career and I needed Jesus, to be honest. And I didn't realize, oh my gosh, this is a lot of the missing pieces that mental health specifically doesn't cover, psychiatry or psychology, whatever. A lot of it as far as finding purpose, maintaining hope,
Mm-hmm.
those spiritual aspects that don't neatly fit into depression and anxiety or CBT, that it's so vital to be able to speak to that and to tap into that. I don't know if you have anything else, to add for that.
Right. Because a lot of people, I live in the South, and people have that Christian faith background. And I think sometimes we try to disconnect that from what a person is dealing with. Like I knew for a long time, I thought, oh, if a person has, schizophrenia or delusional, that person can't really have a true connection with God. But helping them to really have that connection can really help to reframe how they think and see things. That would be a whole nother podcast episode though, because you have people who have grandiose delusions. There could be issues there. But I think just helping people to have a good understanding of their faith can support them on their mental wellness journey. Because when it comes to mental wellness, there's like all these, we have mental wellness, we have emotional wellness, we have, you know, um, career wellness, like all those things work together. And if there's a deficit in one area, spiritual wellness, that can impact the other areas of a person's life. So just helping them to have harmony, so to speak, in those different things is really helpful. I hope that answered your question.
It did. Yes. Yes. I just wanted to bring it to light and maybe validate anybody who, like me, thinking, "Oh, well, I didn't learn about integrating spirituality into my social work, but maybe it's necessary." And we don't
It
always have to
is.
go off of like evidence based, right? Because evidence based can be very limited at times. But we will
Right.
do a whole other episode, LaTasha, on spirituality and social work.
Right. And there are actually some good books that relate to that. There's one called, let's see, Spirituality and Social Work Practice. So I wish I had some books to recommend, but that is definitely something to research, going to trainings to learn more about that.
Mm-hmm. But we have time,
Yeah.
so we will definitely schedule a time in the future to record another episode with you. So thank you so much, LaTasha. If anyone wants to connect with you and reach out or listen to your podcast, where can they find you?
All right, so my podcast is called Mindful Nuggets Podcast, and it's available on Spotify, Google, Apple, Anchor, Amazon, Audible, all there. I'm also on Instagram at Mindful Nuggets Podcast as well, so look for me there.
Great. Thank you so much, LaTasha, for your time and everything that you do for the field of social work. It was great talking with you today.
Likewise, thank you for the chance to come on and talk with you and your guests. I have really appreciated this opportunity. Thank you for all that you do as well.
Definitely. Thank you.
All right.